It's 2 a.m. and your feet feel like they're on fire. You throw off the covers, desperate for relief, but nothing helps. Or maybe it's your hands that feel like invisible needles are constantly stabbing you. You mentioned it to your doctor. They smiled and said those two words that make your blood boil. It's just age. But what if they're wrong? What if the real reason your nerves are suffering has nothing to do with getting older and everything to do with something completely preventable? Something so fixable that when you learn the truth, you'll wonder why nobody warned you sooner. And here's the shocking part. The medications you're taking every morning to stay healthy might be draining the very nutrient your nervous system needs to survive. I'm Emily Carter, and I've worked with thousands of patients who believed their nerve pain was permanent. They accepted it as their new reality. But they were wrong. And today, I'm going to show you why. Inside your body right now, there are 45 miles of nerves. That's enough wiring to stretch from New York to Philadelphia. These nerves let you feel everything: your partner's touch, your grandchild's hug, the ground beneath your feet when you walk. Each nerve is wrapped in a protective coating called myelin. Think of it like the rubber insulation on electrical wires. When that coating starts breaking down, everything goes wrong. Signals misfire. Pain receptors go haywire. Your brain receives confused messages that it interprets as burning, stabbing, or shocking sensations. This condition is called peripheral neuropathy. Right now, over 20 million Americans are living with it. That's 1 in every 16 people. Someone in your family probably has it. Maybe it's you. But here's what concerns me most. Many people suffering from this condition have no idea that a simple vitamin deficiency is destroying their nerves. And the truly problematic part is that common medications are draining this essential nutrient from your body every single day. Let me show you exactly how this happens. You visit your doctor. Your blood sugar is high. They prescribe metformin. It's the most commonly prescribed diabetes drug on Earth. Over 150 million people take it. You trust your doctor, so you take it faithfully, but you also have heartburn. Modern life, right? So you're also taking omeprazole or another proton pump inhibitor. Millions of people do exactly this. Here's what nobody explains. Metformin blocks vitamin B12 absorption in your intestines. Studies show that between 10 and 30% of metformin users develop B12 deficiency. Meanwhile, your heartburn medication is reducing the stomach acid you need to extract B12 from food. You've created a perfect storm. Your body is being depleted from 2 directions at once, but it gets more complicated. If you're over 60, your stomach naturally produces less acid anyway. Aging has already weakened your absorption capacity. Add in a plant-based diet, which contains virtually no B12, and you're facing a serious nutritional challenge. Your body needs this vitamin desperately. Every cell in your nervous system depends on it. But multiple factors in modern life are blocking it: the medications, the diet, the aging process. And here's what keeps me up at night. By the time you notice the symptoms, you may have already experienced significant damage. That tingling you keep ignoring isn't minor. That's your body's warning system. That's your nerves sending signals before they deteriorate further. The numbness you're experiencing today could be the early warning of more serious problems tomorrow. I've seen patients lose their ability to walk independently. I've watched people lose their mobility, all because they waited too long to address something that was completely preventable. So what is this critical nutrient? It's vitamin B12, and its story is remarkable. Let me take you back to the 1920s. Doctors faced a mysterious disease they called pernicious anemia. Patients would become deathly pale, weak, and develop severe neurological symptoms. It was considered fatal. Then 3 researchers made an incredible discovery. They started giving dying patients raw liver. These people recovered. They came back from the brink. The scientific community was amazed. Those 3 researchers won the Nobel Prize in Medicine in 1934, but they still didn't know why it worked. It took another 14 years before scientists isolated the compound hidden inside liver. A complex red molecule with a cobalt atom at its core. They called it vitamin B12 or cobalamin. Another Nobel Prize was awarded just for discovering its structure. Think about this. One molecule was so important to human health that it earned 2 Nobel Prizes. But why? What makes B12 so critical? It's essential for your entire nervous system. It performs 2 jobs that keep your nerves functioning properly. First, B12 powers something called methylation. During this process, it transforms a potentially harmful amino acid called homocysteine into a beneficial one called methionine. When this system works, your body manufactures compounds essential for building and repairing myelin, that protective coating around your nerves. Without enough B12, homocysteine accumulates to concerning levels. This can damage your nervous system while simultaneously preventing repair. Second, B12 is vital for energy production inside every nerve cell. Each cell contains microscopic power plants called mitochondria. B12 is part of the fuel they need to function. Without adequate B12, specifically in its active form, these cellular power plants start struggling. When they struggle, harmful substances can build up. This doesn't just affect energy production, it can damage the myelin structure itself. You see what's happening? B12 deficiency attacks your nerves from multiple angles. It prevents repair of the protective coating while simultaneously affecting the nerve from the inside. That's why the symptoms can be so severe. That's why people experience such significant discomfort. That's why early intervention is so important. But here's where hope enters this story. If you've recognized yourself in what I'm describing, there's a clear path forward. But you need to be strategic and informed. Step 1 is getting the right tests. Don't just accept a standard B12 blood test. This is critical. Many laboratories consider anything above 200 picograms per milliliter as normal, but that number may be too low for optimal nerve health. I recommend levels above 450 to 500 picograms per milliliter, but even that's not the complete picture. You should also ask for methylmalonic acid, abbreviated as MMA, and homocysteine levels. When these markers are elevated, it's a clear signal that your cells need more B12. Even if your basic blood test looks acceptable, these functional tests reveal what's actually happening inside your cells, not just what's floating in your bloodstream. This distinction is important. Step 2 is choosing the right form of B12. Pay attention here because this matters. Walk into any pharmacy and you'll find inexpensive B12 supplements. Most contain something called cyanocobalamin. This is a synthetic form that your body has to convert into usable forms. Many people, especially those with certain genetic variations, can't do this conversion efficiently. What you want is methylcobalamin. This is the bioactive form your nervous system uses directly. Even better is finding a supplement that contains both methylcobalamin and adenosylcobalamin. This addresses the problem from multiple angles: myelin repair and cellular energy production. Hydroxycobalamin is another excellent option your body converts easily. Step 3 is understanding delivery method. This is where many people make mistakes without knowing it. If you have absorption problems, and honestly, if you're over 60, taking medications or dealing with digestive issues, you probably do, then swallowing pills may not be effective. The B12 might pass through your system without being absorbed properly. You want sublingual forms. These are tablets or liquid drops that dissolve under your tongue. They bypass your digestive system, going directly into your bloodstream through the tissues in your mouth. For severe deficiency or active neuropathy, intramuscular injections are considered the gold standard. They deliver the full therapeutic dose exactly where your body needs it. I've watched patients experience remarkable improvement within just weeks of starting injection therapy. Step 4 is proper dosing. Maintenance dosing is one thing. Addressing active nerve issues is another. For general maintenance, 1,000 micrograms daily is typically adequate. But if you're actively experiencing neuropathy symptoms right now, you may need therapeutic doses anywhere from 1,000 to 5,000 micrograms of methylcobalamin daily for a minimum of 3 to 6 months. Research has shown that 1,000 micrograms of methylcobalamin taken daily produces measurable benefits in diabetic neuropathy patients. Their discomfort decreases, their nerve function improves, and their quality of life gets better. Step 5 is understanding the supporting nutrients. B12 doesn't work alone. It needs specific partners to reach its full potential. Vitamin B6, but only in its active form called P5P, works alongside B12. Folate, specifically as methylfolate, not synthetic folic acid, is essential for the methylation process. Vitamin B1, especially in a specialized form called benfotiamine, has shown good results protecting nerves from high blood sugar damage. If you're diabetic, this is worth knowing. Magnesium acts as your nervous system's natural regulator. It helps calm overactive nerves that may be sending false pain signals. And then there's alpha-lipoic acid, abbreviated as ALA. This is a powerful antioxidant that's both water-soluble and fat-soluble, which means it can protect different parts of your nerve cells. Multiple clinical studies have shown that 600 milligrams of ALA taken daily significantly reduces burning sensations and numbness in diabetic neuropathy patients. Step 6 is making food your foundation. While supplements correct existing deficiency, food provides your long-term support. The richest sources of B12 are animal-based. Liver and organ meats contain the highest concentrations. Shellfish, especially clams and mussels, are incredibly rich sources. Fatty fish like wild-caught salmon and sardines provide substantial amounts. So do grass-fed beef, pasture-raised eggs, and quality dairy products. If you follow a plant-based diet, supplementation isn't optional. It's necessary for maintaining healthy B12 levels. And please don't believe the myth that spirulina or chlorella provide usable B12. They contain B12 analogs that don't function properly in the human body and can actually interfere with real B12 absorption. Here's what you must understand. Nerve damage can become difficult to reverse once it progresses beyond a certain point. The time to act isn't next month. It isn't when symptoms get worse. It's now, before you experience more serious complications. That burning sensation you're feeling isn't just uncomfortable. It's your body's alarm system telling you something needs attention. B12 deficiency is a widespread problem. But unlike many health conditions, this one is preventable, identifiable, and treatable. Your nervous system has a remarkable capacity to heal itself when given the right support. I've personally seen patients who could barely walk across a room regain their mobility. I've watched people who hadn't slept through a night in years finally get relief from relentless burning pain. But every single one of them had one thing in common. They took action early. If this information resonates with you, here's what I want you to do. First, schedule an appointment with your doctor. Request a comprehensive B12 panel including methylmalonic acid and homocysteine levels. Don't accept a basic test that only measures serum B12. Second, if you're taking metformin or proton pump inhibitors long-term, discuss B12 monitoring with your healthcare provider. These medications require vigilant nutritional oversight. Third, share this information. If you know someone struggling with unexplained tingling, burning feet, balance problems, or chronic numbness, send them this video. You might be giving them the missing piece of their health puzzle. Your nerve health matters, your mobility matters, your independence matters, and now you have the knowledge to protect all three. If you found this helpful, please like this video and subscribe to our channel for more evidence-based health strategies for seniors. Drop a comment below and tell me, have you experienced these symptoms? Have you had your B12 levels checked? Until next time, this is Dr. Emily Carter reminding you that taking care of your health means staying informed, asking the right questions, and never accepting that something is just age when there might be a real solution. Stay healthy, stay informed, and keep moving forward.